Hey everybody, welcome back to another episode of Ask Kati Anything. I'm your host, licensed marriage and family therapist, Kati Morton. I'm so glad that you're here. If I sound a little stuffed up, it's because I'm fighting a head cold. Don't worry, I've turned the corner. I figure in like 2-3 days, I'll be right as rain. But if I have a tickle, I might have to cough and we'll cut that out for you. Don't worry. Welcome back. If you're looking to get your question answered and you keep asking each and every week and just doesn't seem to hit for you, know that I also answer questions on my YouTube memberships. You can head over to youtube.com/Kati Morton and you can click the join button. And there's 2 different tiers depending on what you can afford. At the $5 tier, I offer journal prompts, totally separate. Those are every Tuesday and Friday every week. I send those out to you in the community tab. Then at the Psyched Up 30, the next tier that is $14.99, I offer 2 30-minute lives each and every month. And at the Psyched Up 60 at $19.99 a month, I offer 2 60-minute lives, obviously plus all the other stuff that I just mentioned as well. So you can hop over there. You can also go over to Patreon, patreon.com/Kati Morton. I answer questions on a live stream there each and every month as well. Without further ado, let's jump into today's episode. Now, today I'm going to talk about distinguishing between our core personality and our trauma response. Good question. How to figure out what our identity is without our mental illness, and dealing with sexual abuse that can happen via online. Then I'm going to explain how we can know if we're being lazy, how to ask questions in therapy, and if there are any reasons a therapist would ever lie to a patient. Moving right into question number 1. This question says, Kati, how do you help clients distinguish between behaviors or reactions that are a direct result of their trauma versus those that are part of their core personality? Now, there's a lot of other follow-ups on this, but let's just start there. Now, when it comes to teasing that out, I have to be honest, it's going to take time. However, there are some not easy, but maybe easier to spot behaviors that we know are directly tied to trauma. And that would be any symptoms of hypervigilance. If we feel on edge, if we're queued up, always looking like, oh, I don't like to sit with my back to the door in a restaurant, or a car door slams and we jump. Any of those types of high alert, asking a lot of questions, feeling very uneasy in situations until we have all the information. Almost always that is related more to a trauma response. Those are also, I guess we could say, being kind of like explosive or feeling like triggered really quickly is essentially what I'm getting at. But if we feel like we're really explosive, or people always say, like, you're so irrational, you fly off the handle really quickly. If we find that we don't have a very long fuse, that's also usually related to our trauma response. However, if trauma's been happening in our life for a really long time, let's say through our formative years, it might take us time to figure out who we are without it. Because frankly, we don't know. We haven't had an opportunity to get to know ourselves. And that's kind of the difficult but yet beautiful part of trauma recovery, is living in that space where we get to try new things and see if we like something or not, and not have it be colored by the person who was super controlling or by the person who was doing the abuse and us being afraid to be ourselves. And so it's going to take some time for us to figure out what our real core personality is. We might not even know, and there's nothing wrong with that. That's kind of part of the trauma healing process. But just so you know, a lot of the shame thoughts, a lot of the hypervigilant thoughts, a lot of the worry thoughts, a lot of the negative thought cycles, those tend to be, like, with, I'd say 99.9% accuracy, tied back to the trauma and are not part of your core personality. And I really can't encourage any of you enough to take the time that you need to figure out who you are, what you like and don't like, because if trauma's been happening for most of our life, especially during our formative years, we might not know, and it's okay to explore that and to take the time that we're going to need to get to know ourselves. Okay, if that makes sense. And there was a comment on this. It says, similar follow-up, how do I tell the difference between genuine attraction and attraction as a result of trauma? What I mean is that I find myself attracted to people of a similar age to my abuser. It does feel like genuine attraction, but equally, I know that if I hadn't been abused by that person, I likely wouldn't find attraction to people of that demographic. I don't easily get feelings for people my age, and when I do, they also share traits with my abuser, which is confusing and triggering at times. To be truthful, in order to understand this and make sure this isn't what is happening, we have to process through our trauma. Unfortunately, when we have a trauma occur to us, something harmful, something overwhelming, something terrifying, we our brain wants to figure out a better solution for it. It wants to work through it. We want to adapt and move through it, and right? It's kind of like evolve. Our brain and body want to do that. And as part of that, our brain tries to give us similar situations with people, places, things that remind us of that terrifying bad time and try to get us to act differently, to do something in a different way. Unfortunately, that can mean that we're attracted to people that are just like our abuser or share traits with our abuser. And by engaging with them and maybe dating them or whatever, we can find ourselves feeling re-traumatized, right? And we can find ourselves in this pattern of unhealthy relationships and behaviors. And so in order to mitigate that, to make sure that we're not doing that, my best advice is to work through the trauma first before we go dating people. It doesn't mean we can't date, but I'm just saying to ensure that we're not falling into that trap. That's a surefire way to do that. And second, could be to check in with ourselves. Are we attracted to that person because they remind us of our abuser? Maybe instead of going for that person that we feel like we're quote unquote naturally attracted to, we go for the person who just seems kind of boring or nice. Like I even, a friend of mine, Kale Lowry, who has a podcast, I was on her podcast, this is probably like a year ago now. She was talking about how she always ends up being attracted to the same type of guys. And I'm like, you honestly need to find someone who's kind of boring, because you tend to find people who have a lot of drama and chaos, and then you don't like that, but she's attracted to it, right? It doesn't mean we like it, even though we're attracted to it, which I know sounds like those two cannot co-occur, but they do all the time because we're used to it. It's what we have grown up with and we've gotten accustomed to. And so it feels comfortable. And we often, we assume that comfort equals attraction, and those are not the same thing. And so when we've had, also as a side note, when we've had trauma in our lives, when things are comfortable, that can feel unsafe because it can feel like it's us putting our guard down, right? And that makes us vulnerable. And so there's a lot at play here. And I really can't encourage you enough to go for the person who is maybe not your normal person you're attracted to, not the most attractive to you normally, or work through the trauma, and ideally both, because that will ensure that we aren't picking someone just because they are similar. And if you're concerned, like, hey, am I really attracted to this person or not? Have your questions you ask yourself and be honest. Like, do they remind me of them in this way? Are they the same age? You said demographic is specific. So are they in that same demographic? And if the answer is yes, then that's probably not a good choice for you. And so that's an easy way to distinguish. But usually I find we have a difficult time distinguishing between comfort and attraction, especially when we have a trauma experience in our past. So hang in there. It does get better. And as someone even who dated people, I had this horrible pattern of dating like dickwads for a long time. And I would pick them specifically, right? I know that you can change that because I did. So you can do it. It is uncomfortable and it's not the easiest, but nothing in life is. So, it's like that old adage or thing I've seen online a lot that's like, pick your hard. Like it's hard to be sick all the time, but it's also hard to get treatment and follow through. Pick your hard, right? So it's hard to date people that maybe we aren't initially like super excited about, but it's also hard to continue dating the same person and getting the same result because we don't like that, or dating someone who reminds us of our abuser, right? Pick your hard. And so know that you can work through it and we can pick better people. We just have to almost get like our picker back in line with what's healthy for us. Now there's another add-on that says, how do you tell the difference between trauma memories and normal ones? Are trauma memories made fragmented or do they become fragmented? Great question. For context, when I was seeing a therapist weekly, I could describe a decent level of detail in recent stressful or traumatic situations. Currently, I'm seeing a new therapist every fortnight or less, for those of us in the States, every 2 weeks. Whenever I try to explain these past situations, I can't recall details. I can kind of remember that there was ongoing repeated conflict or manipulation, and I get easily triggered. But I struggle to describe specific examples. I feel like I'm making it all up. Do I have a bad memory, or is it because they are trauma memories? Why is it that I can remember every detail for a short time, like, for example, a week, but not long after that? Help. Thank you so much for everything. Of course. When we have a trauma going on, it's important to remember that our amygdala sounds the alarm, meaning our limbic system is firing. We go into our stress response, known as fight, flight, freeze, fawn, okay? And I wish I could like show you a brain of what's happening. But what happens when our limbic system is triggered and our amygdala is firing? It's like the fire alarm in our brain. It's like, wing, wing, wing. Our prefrontal cortex, a lot of our prefrontal lobe goes offline. Boop. it's like, I'm not necessary right now. I'm going to take a step back while the amygdala runs a show. Now, what that means is that our body goes down to like basic needs, basic, can I live and survive type of stuff, right? So we won't have to, we'll either feel like we have to pee immediately, or we'll like be able to hold it forever. Like our body's like, you know what? We just have to get through. Our pupils will dilate so we can see better, take things in. We will feel very like we're breathing a lot. We're very vascular. Our body is dumping adrenaline and endorphins to get us moving. And there's a ton of other things that happen during this. That's what happens when we're traumatized, whether we recognize it or not. That like shortness of breath, maybe sweaty palms, just the feeling of being terrified does something to our nervous system, okay? And I bring this up because while that's happening, our brain isn't always able to form memories. And it can happen in two types of ways. Now, I don't know, only you're going to know through therapy if there's a memory there or not. But when we are in our stress response, and let's say we're pushed so much into freeze that we dissociate, our brain pulls the ripcord on reality to protect us from the current situation. And we know that during dissociation, it is incredibly difficult for our brain to form full memory. That doesn't mean there won't be fragments, but it might not even have that memory. We also know that during dissociation, we can have these memories be formed, but they're immediately repressed, almost as if they're like out of our reach, like they never existed in the first place. And it can take intensive therapy for us to find them out. So we can have those two scenarios. One where it's like, it's not even, the memory doesn't even exist, or it's like fragmented at best. Or two, it happened and our brain like, oh, tucked it away. Oop, hit my own headphone. Tucked it away really quick to protect us from it. So then it's repressed and we have to find it out. And we don't really know which one is which until we start working in therapy. But I want you to know this, that even if the memory doesn't exist in its full form, we can still process through it, because the goal of therapy is to help us mitigate or better manage the behaviors and symptoms that are coming up for us, the things that are upsetting. We want to be able to better handle that. And if we, even without the memory, we can still do that. Does that make sense? So it's like, regardless of whether we have it and it's repressed or we don't, because it's not fully there, we can still work through it. I know it's kind of a shitty answer, but it's really the truth that trauma memories can be full and clear, but repressed, and can be fragmented or non-existent or any version in between. It just really depends on our level of dissociation at the time and our brain's ability to formulate those memories. Because our goal of our brain and body, an important thing to remember too, is that the goal of our brain and body through a trauma is to survive it. And so if that means it has to pull the ripcord on reality, aka dissociation, or if that means it has to stuff this memory down so that we don't have to deal with it because we're in a crisis, like repression, it's going to do what it has to do to get us through, because that's its goal. And so the only way to know what your brain and body really did is through therapy and through figuring out if there is a memory there or not. It sounds like yours is probably fragmented, maybe due to dissociation, but only you would know that. But you're not alone, and we can still work through it, because it's more about how it made us feel and the experiences and the symptoms or signs that come up for us than it is about the exact memory. I know it sucks and it's really frustrating, but that's the truth. So hang on to that. Okay. Now, there's another add-on that said, how do you even know what is making sure you fit in with a situation or group? Oh, how do you even know what is you? So one part, you making sure you fit in with a situation or group, or making sure everyone else is comfortable, acting and talking in a way is least likely to get a bad reaction or make someone angry, versus what is really you. So what is kind of like people pleasing, wanting to fit in, stuff like that, versus what is really you and how you are as a person and what you would really want to do, etc. The truth about that is, if you were on your own, this is a great check-in. So if we find ourselves like, hey, I'm a super people pleaser, I really want to fit in, especially when we're teenagers, it can be really hard. But what would you do on your own? If no one else was around, no one else is going to be affected. If you can check in with yourself during those situations where you're like, am I just going along with this because other people want to? Like, maybe later or in the moment, we can reflect on that and be like, if no one else was here, if nobody else knew what decision I made, if no one else heard that this was happening, what choice would I make? That'll tell you what you truly want. So often we just don't even check in. And we don't, because we've been so disconnected, we're like, well, I don't really know what I would want. Well, take some time to get to know yourself. Try new things on your own. Maybe even just journal about it or think about it. Like, Okay, well, if someone said, hey, I want to watch a horror movie, what's my immediate reaction? Ugh, I hate horror movies. I'm speaking personally. I hate horror movies. I don't want to watch that. But if I really want to fit in, I might be like, yeah, cool, because everybody else thought it was cool, right? We know that. We just have to take a minute to consider. A minute to think, if I was all by myself, what would I do? That'll tell you what's really you and what's you trying to fit in or please others. And know that we all try to fit in. We all try to please others. There's nothing wrong with you for feeling this way or acting that way. We've all done it. We all do it. But it's good to check in sometimes to at least manage or understand how often we're doing it. Okay? Now there's a final add-on. It said, how do I distinguish between attaching to someone because we get on well versus attaching because of trauma or similar dynamics? I think it's all about healthy attachment. Healthy attachment is, I love seeing you. I'm excited. I want to share with you what's going on with me. I want to hear from you. There's a give and a take. And I'm not really concerned that you're going to leave. I'm not concerned that you're going to know too much about me. It's just a nice, healthy dynamic of sharing and connecting. And if I think of you, I reach out, but it's not obsessive. I don't feel like you have to respond right away. I'm not offended. Like, even just as an example, one of my best friends, I had just texted her because I'm going to LA, and I was like, hey, because she has an extra room. And she was like, next time you come out, you should stay with me. And so I was like, hey, I'm going to be in for these days. Do you have those 2 nights? Could I stay with you? No pressure, no whatever. And she didn't reply until today. And then she was like, oh, sorry, yesterday was just a blur. And I was like, I wasn't worried about it. I wasn't stressing about it. And so that's kind of like a healthy attachment. And anything else, if we feel push-pull, if we feel like I'm so afraid that they're going to leave, if we feel like I'd rather know more about them than they know about me, I'll take care of myself. I can't count on anybody else. If we feel those kinds of what I would call unhealthy attachment, we're talking, anxious attachment, avoidant attachment, or disorganized. If we feel that kind of push-pull, then that is most likely coming out of trauma or other similar dynamics. There's nothing healthy that comes out of that. And so if you feel that experience, you feel super attached or not attached, that's how we know that it's not healthy. And then it's probably coming out of that. Otherwise, it's fine. Okay, moving on to question number 2. It says, Kati, what do you tell clients who've been depressed or anxious for so long that they don't really have an identity that excludes their illness? Great question. If your illness is part of who you are, how do you grow away from it? Edit for clarification. I'm specifically referring to childhood mental illness that lasts into adulthood. And another add-on I just want to read at the same time says, I think the hard part is to not know who you are without it or what's supposed to feel normal. To be truthful, these are great questions, a lot of identity questions today. And the truth about how do we really have an identity that isn't our illness, I don't see, this might be not a popular opinion, but I don't really feel like we have to be like, this is who I am, this is what my mental illness is. Our mental illness is not who we are, but the experience of it does change us a little bit, right? I can't say that experiencing depression in my life hasn't altered who I am or given me empathy for those going through it as well, right? And I don't think you can either. So I feel like to try to separate ourselves from, like, quote unquote, who we are, it's not really possible. But here's what I can tell you is that I want you to know that you can live a life without the symptoms of your depression or anxiety, and that will be a whole new version of you. Just like I said back at the beginning, that if we haven't had an opportunity to get to know ourselves without it, like without the trauma response, that was that first question, then we have to take the time to get to know ourselves. Like, depression robs us of enjoyment of a lot of things, so we might not even know what we like. So guess what? If we feel a little better, we don't feel so depressed, maybe we try out some things, see what we do like. Maybe we're like, my friend says she really likes playing pickleball. Everybody's playing it. I haven't played it. I'm just throwing it out there. Maybe we give it a try. We're like, maybe I'll like it too. But we give it a try because we have the energy to do it. Yay, no depression. And also we think we might enjoy it. Oh my God, hope for the future. No depression. Amazing. And so it's really not that we're going to be able to tease out who we are, who we aren't. I could tell you the symptoms of depression. If you watch my depression videos, you can see those symptoms and you can probably apply them to yourself and consider how that alters the way you interact with the world. Those would be your depressive symptoms, right? And so what's left would be truly you. We could do that work. But instead, I think it's like, Okay, without it, what would I want to do? Okay, anxiety is uncontrollable worry. So if I feel super anxious, that means that I'm probably not very easygoing, can't go with the flow. I might not like to be in public places, out with a lot of people. Okay, so if I don't have that, then maybe I do like that stuff, right? We can take our symptoms and we can understand them. We can see how they apply to us. And if we didn't have them, when we don't have them, when we're going through treatment and feeling better, then we can see if maybe we would be different. But I just don't really feel like it's necessary to figure out who we are, because it's a part of our story. It's not the whole story, but it's a piece. It's like the college that you went to or the job that you decided to take on. It's not everything about you, but it's a piece. And this is the same, I kind of give it the same weight. And so I really, when it comes to how I work with my patients, I try to get them to see the symptoms and how they're affecting them, have them take note of that. That in and of itself tells you what is your mental illness and what is you. That already is breaking that up. So we can do it that way. But I do that a lot with my patients. And then as the symptoms reduce and as they start to feel better, I encourage them to explore their true self. And that's what I encourage you to do as well. Because if it's been around since childhood, it is a big piece of our story. There's nothing wrong with that. And without those symptoms, as you feel better, what do we like to do, right? It's okay to learn. We're all learning who we are. I'm different than I was, 5 years ago, 10 years ago, heck, like 2 months ago. I'm a different person. And it's okay to be different. It's okay to change. And we should try new things all the time. If we get older and we're like, I don't like that. I've always hated when older people are like, I tried that like a long time ago and it's just not for me. I mean, it's fine to have strong opinions, but I'm always like, you could try it again. Might be different now. Things are different. Like technology is different. It's like if I said I didn't like skiing, well, skis are very different now than they were when I was a kid, right? I know those are random examples, but I feel like challenge yourself to try things and see what you like and don't like, and note what your symptoms are and how they're affecting you. That could help you tease that out a little bit, okay? And the add-on about like the hard part is knowing who you are without it, or what it's supposed to like, what is supposed to feel normal. Normal's such a it's not a word that I love. I call it baseline. And everyone's baseline or everyone's normal is going to be different. And so we have to figure out what that is for you. And again, that's work in therapy. Like, what do we think our baseline is right now? Where would we like it to be? Especially if we're still feeling depressed or anxious, our baseline is going to be more depressed or anxious. And so we're going to have to try to talk with our therapist to figure out, maybe my baseline is this, but I wish it was more like that. Okay, well, that's a good goal. That's where we want to work towards, right? And that will be the normal for you. And know that if your normal now is super uncomfortable, it doesn't have to be forever. We have to find the right care so that we can start to better understand and better manage those symptoms as they come up, okay? I hope that makes sense. Moving on to question number 3, it says, "Hi, Kati, I hope you're well. I'm feeling really confused, scared, and frankly, just shit. I've started college this year, and we have just had an online safety class as an introduction." Okay, that's wonderful. I'm so glad. "This led me to having a panic attack, and with the pressure from my tutor continuing to ask what is wrong, I ended up telling her something now I wish I hadn't. For context, earlier this year, just before leaving high school, I started chatting to a boy online. Stupid, I know. We've all done it. There's nothing wrong. Back in the day, we had chat rooms when I was a kid too. I chatted with boys online. I was under the impression that he was just 2 years older than me. It was all normal at first, and it was nice to finally have a friend. I struggled to make friends, and he said that he did too. But this slowly moved into him asking me sexual questions. Ooh, it's not safe. I will admit, I've never really been clued up on sexual education, and I realize now how he took advantage of that, saying he can explain different things via role play, online sexting. It seemed so normal at first, and genuinely seemed like he was just helping me understand what different sexual things mean. It's grooming, online grooming, but we'll talk about this. Again, I realize now it was his way of engaging me in fantasy play with him. After a bit, he was trying to persuade me to send pictures, and I was like, no. He found out where I went to school. Oh my God. And said unless I sent him pictures of myself, he would come to school and assault me. He reminded me that if I told anyone, I would be the one in trouble for talking to him online. I eventually gave in. He ended up being a guy in his 50s. That's disgusting. I'm so sorry. He said if I told anyone, he would ensure that I would be hurt. The threats, goddamn. When I told my tutor that I was told I should have known better. Wait, what? When I told my tutor I was told I should have known better and was very stupid for doing what I did. How? The audacity. I'm so sorry. I feel ashamed even more that what I was already feeling And now I don't know what to do. They've said that due to my age, he will have to they will have to contact the police. My parents are furious with me. I wish I never said anything because my own fault that this happened in the first place. I just want to run away, but I can't. And I'm terrified of what will happen next. First of all, you are not at fault. I'm so sorry. I'm so sorry this happened to you. You were taken advantage of and you were groomed. Now, I have a video about grooming. I have a couple videos about grooming. You can just look up grooming Kati Morton online. Unfortunately, not enough people talk about this, but grooming is essentially when an adult tries to engage in a relationship with a child with the goal of manipulating them into some kind of sexual abuse situation. And grooming is slow, just like it happened. It's not like he asked you right away to send pictures. It was a slow process that he took you through things that you're like, I'm a little uncomfortable with this, but you're like, right? They wait until it's just slightly uncomfortable, and they think that we're persuadable. And it's a manipulation tactic. It's an abuse tactic. Grooming is abuse. You were abused. And that tutor's obviously uneducated. And I'm so sorry that they said what they said to you, but that's not correct. You are not at fault. This person is at fault. And you could, if you want, you could go to the police and you could file a report. It's completely up to you. I don't want you to feel any pressure to do any kind of thing, but I want you to know that you are not at fault here. You did nothing wrong. Obviously, we learned a lesson because we were taken advantage of. You were abused, and that sucks, and I'm so sorry. You have every right to feel traumatized. You have every right to feel overwhelmed. I'm sure it's coming with a lot of shame, blame, and embarrassment and guilt. I'm so sorry you're going through that. I don't know if you're able, but I would encourage you, especially at college, they offer it for free. I went to free therapy in college, all through grad school. See if you can get into a therapist there. Let's start talking about this. Something bad happened to you, and I want you to feel free to talk about it in a non-judgmental place because this was abuse. You were traumatized. Someone took advantage. It's not your fault. You should feel free to be online and chat with people and talk and make friends. It should be safe. Unfortunately, creepy fucking 50-year-old dudes are grooming people and looking for victims. And I'm so sorry that happened to you. But I want you to know it was not your fault. Okay? You were abused. And so let's find a way to get you some support. Know that it's all confidential when you do it at college because you're over 18. So your parents don't have to know about it. But let's get you some support so we can work through this, okay? Hang in there. It'll get better. You're okay. I mean, with what will happen next, it's all you get to decide. You're an adult. You don't have to file that police report unless you want to. He should be in trouble and he should be behind bars, but you don't have to go through that if you don't feel up to it. There's nothing that says you have to. So I want you to feel able to make the best decision for you, okay? So let's get into therapy, and that will help you make those decisions and ensure that it's all based on what's best for you, okay? Moving on to question number 4. It says, Kati, how do you know when you're lazy? After therapy, depression might be gone, but one is used to doing nothing and getting back on track. Okay. I've talked about this. I talked about this last week, I believe, or 2 weeks ago. If you're being lazy, you'd be enjoying yourself. Being lazy is something like that we kind of relish in. Oh, so nice. I have a lazy day. It's so nice. I don't have anything to do. I get to just be lazy. It's nice. It's relaxing. It's like Garfield, that cat on a couch. He's just so relaxed. That's how we know we're being lazy. Or lazy is like, someone asked me to do something. Yeah, I don't feel up to it. I don't really want to. I'd rather just stay here, right? There's a difference, okay? Lazy is enjoyable. Lazy is I do only what I want. Depression is that feels like too much effort. I can't do it. Oh, I'm such a piece of shit. And then negative self-talk. That always goes together with the depression. If we're lazy, we just don't do it and we don't think another thing about it. So if you're ruminating and shit-talking yourself, having some kind of negative conversation about how lazy you are, then that's depression. That's not laziness. I feel like laziness is this word that we use to shit on ourselves all the time. If we have ADHD, we've probably been told we're lazy. If we have depression, we've probably been told we're lazy, or anxiety. People use that term, or we use it personally, to put ourselves down when in fact that's not what's going on, right? It's not the full story. Lazy is, I don't want to, and we don't think about it. Everything else is, I can't, it feels like too much, I don't know how to, and then we shit talk ourselves. So pay attention. I hope that helps discern between lazy and everything else, because unfortunately that term is always thrown around and everybody thinks they're being lazy when in fact they're probably depressed or have ADHD and it's hard to focus, or struggling with anxiety and can't think about anything else but not embarrassing ourselves, right? So hopefully that helps. Moving on to question number 5. It says, Kati, why am I worried about asking questions in therapy? I have an incredible relationship with my long-term therapist, but I cannot bring myself to ask questions. It's not just about her, but about what she thinks about why I do things. Her thoughts on my current diagnosis, her advice on what to do, etc. I don't have this issue with any other relationship. I suspect I'm worried about rejection, or maybe her answer not being what I want to hear. I have BPD, borderline personality disorder, OCD, obsessive compulsive disorder, an eating disorder, and complex PTSD, all of which are very well managed, and I am high functioning again. Wonderful. That's amazing. It sounds like her feedback is hard for you. And so I'm very curious. This is where my brain goes, and I could be completely off base, but you said it's not just about her, it's about what she thinks and why. So it's almost like the judgment is too much for you. And so I'm curious about that. And I would love for you to maybe journal a little bit about what it is that she's said in the past that makes you concerned about her judgment, or do you feel judged in session? And then you said you're worried about rejections, what you suspect. So is it that we're trying to fit in, or we feel like we don't fit in with what she's wanting? Is that part of our BPD, I wonder? I don't know. I have a lot of questions because I can talk about the being worried to ask questions in therapy. I know some of us can be concerned if it's okay, or how are we wording it? Are they going to understand? And that's regular stuff because it's a different type of relationship, right? And it's perfectly okay to ask any and all questions in therapy, even about therapy itself. Like, how does it work? How much is it going to cost? What if I'm late? What if I get sick? Blah, blah, blah. It's good to ask all those questions, but also like, do you do CBT therapy? What's your training? Where'd you go to school? We can ask our therapist all those questions, okay? Perfectly normal. But in this like specific question, it sounds like it's more you're worried about her judgment, her feedback on things. And I wonder if receiving feedback, whether it's constructive or not, has always been hard for you, and where else we've maybe run into this. And is it specific to her because we actually value her opinion? I don't know. I'd tell her this is going on. There's nothing wrong with it. It'll help us dig into like, where is it really coming from? Is it because we really want her approval? Do we see her as like a parent figure we never had? I don't know, right? I have some questions because it might be coming from that, and that might be why we don't really want her to reject us. We want her to accept us because that relationship is really valuable to us. So let's dig into some of that, because that's my hypothesis as to where it's coming from and why this is coming up. But again, it's okay to talk about it with your therapist. Be like, I get so worried, and getting your feedback, I'm like, I get stressed that like, I don't want you to judge me, or I'm worried that you're not going to like me, or your advice on what to do is going to be too much for me to take. You know, I have a feeling there's a lot tied up in this, and it might be a little more complex than just like, I need to ask more questions in therapy, or I need to, get more clarity from my therapist. Yes, we do, but something's holding us back. And I think it's something to do with attachment. I suspect a little bit of like judgment. Like you said, like the fear of rejection, that relationship might be important for some reason or another. What role does that relationship play in our life? Is it like the only consistent one? And so it feels really risky or scary to open up, ask questions. I don't know. You tell me. Do some of that digging. But know that feeling all of that and experiencing that is very normal. Our therapeutic relationship is so unique and different that it often brings up a lot of other things that we've been dealing with in our life. It's that like only safe place that we have to really be who we are and to share the nitty gritties and the maybe dark, dirty parts of ourselves that we don't really show to anybody. And so when we're doing that, it can bring up a lot of other concerns, and that relationship can become incredibly valuable. And that's all normal. That's okay. There's nothing wrong with it. It's not crazy attachment stuff. It's just kind of often part of the therapeutic process. So let them know this is happening, and let's see where we can figure out where it's coming from. Okay. Final question number 6 says, happy Sunday. I hope you're well. I'm actually recording this on a Friday because of my cold, but happy Sunday. Could you explain if there are any reasons a therapist would lie to a client? Great question. Are there any situations that would be acceptable or unacceptable? I recently found out that mine has, and it shattered my trust on an emotional level, but also on a logical level. I can understand why they may have lied. They would like to think they have my best interest at the forefront and not intentionally wanting to upset me. For context, we planned a break for therapy for a period of time, and the lie meant that we ended earlier than expected, very abruptly, when I was going through the worst months of my life. I now feel so let down and unsupported, and I find myself questioning other things. I would love to know your thoughts. Thanks. Therapists will lie to patients, to be truthful, not very often. I mean, the only time I might lie to a patient, and lie is a strong word, is more like if I was having my own personal reaction, which first of all means I need to be in my own therapy. I may lie and be like, this is okay, you can keep sharing, even if I know internally I'm very triggered. That would be a lie that I might offer up to a patient. But that would mean, again, I need to get my own shit together. To lie to a client, really, I cannot think of a reason why I would lie. I obviously am not going to say, oh, I'm shocked, I've never heard that before, even if I am, and I haven't. That's like holding the space. I don't feel like that is so much lying as it is doing my job and being like a blank canvas for you so that I'm not overreacting or responding in a way that could perpetuate some kind of trauma response. Does that make sense? I would lie to a client, I guess, if they asked if I was seeing someone else, because I can't tell them. So it wouldn't really even be lying, it'd just be omitting, be like, I cannot confirm nor deny. That would be my response. I really thought on this, you guys, before filming, and I cannot think of a thing that I would actually lie to a patient about. I'm pretty upfront with my clients. Obviously, there can be situations that, like I've had similar situations where I've had patients who lied to me. And so I was looking to refer them out, and then they try to come clean. No, it wasn't bad. I wasn't doing that. And so I would say like, well, I think you need to be referred out. And they'd be like, but I'm going to do the thing you told me to do. Again, that's not lying. Ugh, sorry. I was trying to think of another option and I can't. So I really do not think there are any reasons that a therapist would lie to a client unless it was just in order to hold the space for them or to keep confidentiality for someone else. Those are the only reasons that I would lie to a patient. I feel like that's just not the role of a therapist. I mean, our role is to normalize and hold the space. And in that can mean that we, pretend that we've heard this before, even though we haven't, or we act like it's normal, even if we aren't sure. But that's not like actually in a hurtful manner. And you'd never find out about that kind of I wouldn't even call it a lie. I'd call it therapeutic support. So I don't really think there are any that are acceptable in my brain. And I think it's unacceptable to lie to a client about anything that could potentially hurt them. Like I wouldn't want to lie about having a specialization I don't. That's unethical and potentially illegal even, probably. And I could get a strike on my license, which I should if I lied about that. I shouldn't lie about essentially any of my capabilities as a therapist or any of the rules of therapy. I shouldn't lie about understanding something if I don't. I'm talking as a therapist. I shouldn't lie about really anything. I don't think that's really acceptable at all. I'd love to hear your guys' thoughts. This question honestly caught me kind of off guard. And I spent so much time earlier today just thinking about like, what would I possibly lie about? And the only things I could think of were like ways to offer support, even if I was overwhelmed, or like, oh, don't worry, I've heard that before, even if we haven't. And those are all kind of therapeutic tactics to help you feel seen and heard. Because it's hard to share. And just because I haven't heard specifically about this exact situation doesn't mean that your situation's weird. It just means that I haven't encountered that person yet, right? Like that's not hard. I don't see everybody, but I really don't think it's appropriate for the very reason that this question even came across my desk is the fact that it really shatters our trust in our therapist. And I don't think it's appropriate or something that a therapist should do. Obviously, a therapist doesn't have to tell a patient everything about their life. Like if I'm going on vacation and they keep harping on like where, and I still wouldn't lie. I would just say, I'm just going on vacation and don't worry about it. I'll be available, or this person's covering for me. Yeah, there's just no real reason to lie. Again, because the trust in a therapeutic relationship is just incredibly important. It's really what everything else is built on. And it's how we learn to feel safe and secure in that space. And I Unfortunately, I'm sorry that your therapist did this. I don't think they're very good at their job, and that's very disappointing. And I don't know why they ended earlier than expected and said you need to take a break and like kind of lied about what was happening. That's not really appropriate. And that really does erode at that therapeutic connection, the reason that therapy is so beneficial and what makes it so special. So I'm so sorry you're going through that. I'm sorry that your therapist lied. I don't think it's acceptable. And I wish I had a better answer, like, oh, these are the things that we could and these are things that not, but I just really don't think there's a time when it's appropriate. Because that dynamic is really, really vulnerable, and it's really important and vital to therapy. And so we really want to be careful with it. Okay. Thank you all so much for listening and watching. Thank you for sending in your questions. Thank you for bearing with me as I, roughed my way through this. Have a wonderful, wonderful rest of your week. Do your homework, and I'll see you next time.